everyone. My name is Adeline Cook, and I'm the Director of Recreational Therapy at Wasatch Crest. Wasatch Crest is an addiction treatment center in Utah's Wasatch Mountain Range. February is International Recreational Therapy Month, so in honor of the celebration, I wanted to take a chance to discuss what recreational therapy is, how we facilitate it at Wasatch Crest, and how it helps people with mental health and addiction struggles. So first, I just wanted to briefly overview what recreational therapy is. So what rec therapy is a systematic process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with illnesses or disabling conditions as a means to psychological and physical health, recovery, and well-being. Recreational therapy or therapeutic recreation is a treatment service designed to restore, remediate, or rehabilitate a person's level of functioning and independence in life activities, to promote health and wellness, and reduce or eliminate the activity limitations and restrictions to participation in life that are caused by an illness or disabling condition. The purpose of recreational therapy is to improve and maintain physical, cognitive, social, emotional, and spiritual functioning in order to facilitate full participation in life. Recreational therapists use a person-centered approach to therapy where recreation and experiential-based interventions and psychoeducational processes are the primary treatment modalities. So what do recreational therapists do? Recreational therapists use recreation and leisure-based activities. So, for example, art, music, sports, games, nature, and relaxation, to name a few, in order to provide developmentally appropriate support to clients and families, to assist in the improvement of a client's emotional, social, physical, spiritual, and cognitive well-being. We help identify, develop, and improve a client's functional abilities and independence, and we help decrease or eliminate barriers to successful participation in recreation and leisure activities. We also help clients explore and develop positive coping skills, and then we work on community reintegration, which is a big thing in substance abuse treatment. So we help transition clients from a care setting to develop a healthy leisure lifestyle, which supports continued recovery, improved health, and greater quality of life altogether. So recreational therapy really benefits individuals with mental health and substance use disorders, and I'll explain why. So the cool thing about recreational therapy is that it uses a holistic approach to improve the functioning and enhance independence in people's lives. It uses evidence-based interventions to reach the assessed outcomes, and it also incorporates the client's interests, family, and really the entire community to make the therapy process meaningful and relevant to the client. We teach lifelong skills like communication skills training, the exploration of new leisure interests, the development of new coping skills, all to improve quality of life. So it's kind of like an all-encompassing profession. RT embraces an emphasis on health, which includes not just the absence of illness, but the enhancement of physical, cognitive, emotional, social, spiritual leisure development. It uses recreational modalities in the designed intervention strategies. So rec therapy is extremely individualized to each person by his or her past, present, and future interests and lifestyle. As a recreational therapist, I believe I have a unique perspective regarding the social, cognitive, spiritual, physical, and leisure needs of the client. What I do is I kind of weave the concept of healthy living into treatment to ensure not only improved functioning, but to enhance independence and successful involvement in all aspects of life. So let's get into what rec therapy looks like at Wasatch Crest specifically. So our department mission in the recreational therapy department is to provide clients with a variety of effective therapeutic modalities which empower them to rediscover their passions, develop motivation, and exercise survival skills to face trials and build meaningful lives in recovery. Our rec therapy groups focus on self-efficacy, resilience, interpersonal connection, positive communication, self-awareness, self-advocacy, stress management, and self-discovery to promote this holistic sense of well-being and recovery. We utilize yoga, meditation, mindfulness, experiential therapy, service, spirituality, music, adventure therapy, the outdoors, leisure education, and creative expression as trusted interventions to bring about positive change. So the service delivery model for rec therapy is as follows. In order to determine which interventions and modalities are best suited for the client's needs, I utilize a systematic process of assessment, planning, implementation, evaluation, and documentation. So first, I use a comprehensive assessment to generate diagnostically appropriate baseline data that identifies the client's strengths and limitations in functional areas: physical, cognitive, social, behavioral, emotional, spiritual, and leisure. I primarily use assessment procedures such as structured interview, direct observation, information gathering from other treatment team members, and or record review. And then after that, I interpret assessment data to develop an individualized treatment plan that includes relevant short-term, long-term, and discharge goals. All factors that may influence treatment strategies are considered in this planning process. So the client's diagnosis, any precautions or contraindications, and this all happens when the client and I are developing the treatment plan together. So some of the goals that I set with our clients include identifying new leisure interests, rediscovering passions for past and current leisure interests, developing new coping skills for anxiety, depression, anger, and stress, increasing self-esteem, enhancing spiritual connection, improving communication skills, so like assertiveness training or asking for help. And then I also work on decreasing or eliminating physical barriers to participation in leisure activities, and I help the clients discover modifications and adaptations. And then for the implementation part of this systematic process, all of the implementation strategies that I used are based upon the assessment and then the treatment plan that I make with the client. So this is going to include the type, frequency, duration, and the intensity of the interventions needed to achieve the expected outcomes. I consistently review, modify, or discontinue rec therapy interventions based upon the client's progress or if there's a change in condition. And I facilitate a lot of different interventions, groups, and modalities at Wasatch Crest. So I'm going to go over what I do and what groups I facilitate. So first, I'd like to bring up experiential therapy. So experiential essentially means learning by doing. It is a therapeutic technique that uses expressive tools and activity interventions such as role-playing and acting. We use props, expressive arts, music, animal care, guided imagery, team building exercises, and then various forms of recreation. And we use those to reenact and re-experience emotional situations from past and recent relationships. I facilitate experiential group therapy once a week for about 1.5 hours. And these groups focus on things such as communication, stress management, problem solving, social support, trust, team building, and goal setting. And then I utilize these activity interventions, which are very interactive in nature, to bring about a processing discussion on the above mentioned themes. So this is where clients are encouraged to reflect on how they can take what they learned from group and apply it to real life situations in recovery. That's kind of where everything all comes together. There's often a common misconception about recreational therapy in general, that we are just playing games or doing activities with the clients, but everything, as I like to say to the clients, has a point and a purpose. So if we are utilizing props, such as there's this one group I do called Pipeline, where we use like cut up pool noodles and marbles, and they have to like transport these marbles using only the noodles and safely deposit it into a little bucket. So if we're playing with those props, there's always going to be a point and a purpose. And usually with that one, it is stress management, because they get very stressed out about that marble. Okay, so next, I also facilitate yoga and meditation. If anyone watching is not very aware of what yoga is, it is essentially a spiritual and aesthetic discipline which focuses on bringing harmony between the mind and body. In yoga, we focus on breath control, meditation, and the adoption of specific bodily postures called asanas to bring about enhanced health and relaxation. I facilitate yoga and meditation 3 times a week for an hour each session. I usually do, on Tuesdays, I do restorative yoga and guided meditation. The goal is to restore emotional and physical functioning and just really to bring about relaxation for the clients. On Thursdays, I do a core and sculpt yoga, which is a lot more upbeat, and we do a lot of core strengthening poses, which is really great for clients that experience back pain. A lot of our clients that come in, we have found that they start taking prescribed opiate painkillers for their back pain, and yoga and meditation has been proven to decrease physical pain up to 38% more effectively than opiates, because opiates really just numb the pain. They don't help it at all. So core is really good for that. When we strengthen our core, it helps our back pain. On Saturdays, we do a lot of balance poses. So we're in warrior poses a lot. We do tree poses. Sometimes we practice supported headstands. And then afterwards, I conduct a vibrational sound healing meditation. So I have all 7 of the crystal singing bowls, all 7 chakras of the crystal singing bowls. So I'll usually do a different chakra on each Saturday. So it's overall just kind of a balancing practice on those days. And we do yoga and meditation and treatment because they are an integral part of early recovery. These modalities are super effective at regulating the stress hormones cortisol and adrenaline. Really, just taking time out of the day to focus on the breath and taking care of the body can help train the mind to be present, as opposed to trying to escape physical and emotional discomfort and pain. So another group that I facilitate is Expressive Therapy. Expressive Therapy uses forms of creative expression such as art, music, and dance to help people explore and transform difficult emotional situations. Unlike traditional arts expression, the process of creation in expressive therapy is emphasized rather than the final product. So I always like to tell the clients that, I'm not looking for Picasso's next masterpiece here. It's really it's about that process of creation and what is going on with you emotionally when that's happening. I facilitate expressive therapy once a week for about 1.5 to 2 hours, and I do have a couple of contract staff that come in and help me facilitate different kinds of expressive therapy groups. So first I would like to mention Mike Liston. He is the founder of Drum Bus, and I met him at a recreational therapy conference about 2 years ago. So he visits Wasatch Crest to conduct a therapeutic group drumming group, also known as a drum circle. Drumming is scientifically proven to encourage emotional and physical release, build community through collaboration, provide an avenue for positive self-expression, improve concentration and focus, develop listening skills, boost self-confidence, and it helps engage withdrawn participants. It's super cool to watch clients that are maybe a little more reserved in group settings come out of their shells when they're in group drumming. And then also once monthly, I have Olive Tree, a local Utah artist, visit Wasatch Crest to facilitate a paint class. Olive Tree strives to cultivate an artistic setting in which clients can express, create, and venture into new methods of coping. In the process of painting, clients are able to develop a sense of capability, self-esteem, and confidence. This class is meant to provide a social and lightly therapeutic setting in which they can explore art and what it can provide for growth. And then a huge part of what we do here are the recreational therapy outings. Twice a week, I take the clients off-site on outings that focus on things like leisure education, leisure resource awareness, self-esteem, resilience, interpersonal connection, spirituality, service work, stress management, self-awareness, and self-discovery. Outings are planned and coordinated with a thorough assessment of the group's capabilities, interests, and needs from a therapeutic perspective. Outings have been a lot different since COVID, but I would like to mention some of the outings that we would do if we weren't experiencing a global pandemic. So historically, we would go to Fit to Recover in Salt Lake twice a month. And Fit to Recover is essentially this amazing community that emphasizes connection, safety, and they don't do just like workout type of groups. They also have like a recording studio where people can come in and do like expressive activities through that. And they also have a kitchen where they do like meal planning and things like that. It's just a really cool community. They do service work, and they also have a couple different like sober sports teams. So it's a great leisure resource for our clients, and we're super excited that we get to do that. We also incorporate Lakota spirituality into some of our outings. Also, historically, before COVID, we would do monthly Lakota sweat lodge ceremonies, and we have a close friend slash contract staff that comes in and preps the clients for, you know, like spiritual principles within the Lakota community. We also do equine therapy once a month, which is kind of a new component to our rec therapy program. That is also facilitated by a contract staff. We do ropes course initiatives in the summer. We go indoor and outdoor rock climbing. We go tubing on the Provo River when it's warm, of course, and then in the winter we do Soldier Hollow tubing. We do a lot of experiential hiking. We go to archery ranges, escape rooms. We play team sports like volleyball and softball. We go kayaking and paddleboarding, disc golfing. We go to the hatchet throwing range sometimes. In the winter, we do ice skating, snowshoeing, sometimes skiing and snowboarding. Laser tagging, visiting local museums. I mean, the list, it goes on and on. We provide like this massive variety of outings for our clients based upon their interests and capabilities. And then another cool thing that we do is volunteer work. So we haven't been able to do a whole lot of volunteer work because of COVID, but in the past, we would go to the Park City Habitat for Humanity Restore facility, and we would kind of help like sort through things that the facility could sell. So we would like be cleaning things, organizing things, setting up furniture, and things like that. Customers would come, and we would load like furniture into their vehicles for them, unload them from the donation trucks. We've also been to local nursing homes before, specifically to like memory care units, so we can interact with the residents there. We also do trail maintenance in the warmer months. So we go to Wasatch Mountain State Park, and we help clean up this trail. It's called the Birdie Shot Trail. Actually, we're in the process of officially adopting it as Wasatch Crest Volunteer Trail. So we started doing that this summer, and it's like a brand new trail, like I said, so we kind of got to be involved in the process of like constructing the trail, which is really fun. So we're really looking forward to getting back into that this spring. Okay, so that was implementation. Those are all the groups that I run, and now on to evaluation. So I frequently conduct these formative evaluations of our clients' progress that are based upon their treatment goals, reviews of intervention strategies, and considerations of client satisfaction and functional outcomes. These evaluations of client progress determine the effectiveness of their treatment plans. Evaluations are carried out through progress notes, collaborative treatment team meetings, and subjective client reports. I also use feedback forms and self-assessment worksheets to gather quantitative and qualitative data on the effectiveness of my program. Following most of my groups, I encourage clients to indicate to me what they learned from group, how they can apply it to their recovery, and then I ask them if they have any feedback for me as a group facilitator, or if they have any comments or concerns about the initiative or the intervention that I facilitated. And then clients are also encouraged to complete a survey specific to the recreational therapy programming at Wasatch Crest before they discharge. And all of those things, what those do is it allows me to modify my programming to make it more effective and relevant for our clientele. And then lastly, there is documentation. This is a huge part of what I do. At the conclusion of each session or intervention, I complete documentation to know individual successes and ways for the client to continue to improve and work on the skills following treatment. A big part of the recreational therapy process here is developing and documenting discharge plans in order to summarize the client's progress, their response to treatment, and then I note recommendations for continued services to meet the client's specific needs. And with these discharge plans, I help the client plan specific times to engage in healthy leisure activities after treatment. Sometimes we set up healthy coping skills plans for things like potential triggers, depression, anxiety, or stress. So after acquiring all of these new coping skills, we sit down and we discuss how the client is going to effectively use those coping skills after treatment. So we make a plan. For example, if progressive muscle relaxation doesn't work, what are you going to do next to like calm your heart rate down if you're experiencing a panic attack? After that, who are you going to reach out to? What kind of activity are you going to engage in to kind of divert your mind from the anxiety that you're experiencing? So it's kind of like a step-by-step process with those. In discharge plans, we also look at social support systems. Is the client going to go to like 12-step meetings? Are they going to get involved in like sober sports leagues? Are they going to do volunteer work when they leave? So with that, we look at potential community leisure resources. And these are based upon what the client needs, whether it's like spiritual functioning, physical, social, emotional, cognitive, and leisure health. So we look at those resources based upon what the client needs to continue to work on. And then we create plans for maintaining self-efficacy and self-esteem and just so much more. Okay, so lastly, I would like to discuss the outcomes of the recreational therapy program at Wasatch Crest. I mentioned that I conduct these formative evaluations of my programming, and from those evaluations and the surveys and even alumni reports, I found that our rec therapy program has been super effective at helping clients primarily define what having fun means and discovering new recreational and leisure interests. The rec therapy program has been great at assisting clients develop new coping skills that take the place of using substances. It's been great at decreasing symptoms of anxiety, depression, and stress through trusted rec therapy interventions. Our program has been really effective at improving communication skills that allow clients to speak more assertively and become less uncomfortable with asking for help. The rec therapy program has helped enhance spiritual connection, and then it has also helped increase and maintain self-esteem. So those are just some of the outcomes that I have gathered and found from the recreational therapy program here at Wasatch Crest. So in conclusion, recreational therapy is really one of the best components of the treatment that we offer at Wasatch Crest. And obviously I'm a little biased, but I truly believe in the effectiveness of what I do. I've seen how our rec therapy program positively impacts our clients' lives and how much of a difference it has made when it comes to growth in all areas of life. I'm so grateful that I found a profession that emphasizes the importance of fun for the rehabilitation of people with disabling conditions. And it just warms my heart when I'm able to witness a client trying a new activity for the first time and see their face light up when they're able to push themselves out of their comfort zones. It is absolutely the most rewarding aspect of this job. So that is about it. I just wanted to say thank you so much for those of you who joined me today. If you would like to know more about our recreational therapy program, please visit wasatchcresttreatment.com. Don't forget to like and share this video, and most importantly, do not forget to engage in a healthy leisure activity today. And happy Recreational Therapy Month!